Okay, so now we're going to start talking about back pain. So this presentation here is on back pain. And okay, so let's go. Okay, so why is back pain so important? Well, back pain is important because it is a common reason for visiting the doctor. It's also a popular reason for missing work and also a leading cause of disability. So for these reasons, we're going to discuss back pain, and this is what makes it important. So what can you do where back pain is concerned? Of course, there are prevention methods, there are home treatments, proper posture, and as well as engaging in proper movement patterns. Okay. So when it comes to prevention, one very important thing that can be done is the addition of a back belt or a back brace. It all depends on the type of work you're doing. If you're into a lot of lifting, construction work, even at the office where you have to lift boxes, a back belt can come in very handy, and it can be a very important preventative method where back pain is concerned. Also for prevention, there's the exercise regimen that you can engage in, whether it's a home exercise regimen or if you attend a gym, doing back exercises to strengthen the back as well as increase the work capacity of the back as well as increasing the flexibility of the spine, and can be very important when it comes to preventing back pain. Home treatments, there are certain methods you can use, for example tennis balls, home massages, that can be done after a long day at work or even during work. If your workplace allows, you can do some massage, self-massage throughout the day as part of your preventative back pain regimen. Proper posture. If you have been assessed to have poor posture, or if you suspect that you may have bad posture, correcting your posture would be very important when it comes to preventing as well as correcting back pain or curing back pain. So as well as the proper office chair. If you know you sit at a desk for a long period of time, having a proper chair with proper lumbar support and even armrests can be very helpful. By having proper lumbar support, you would take some of the strain off the lower back. You would also prevent the lower back from slouching backwards, thereby leading to back pain. Having armrests, if you have armrests on your chair, what this does take away some of the load of the back muscles. So chairs with armrests tend to be better for back pain than chairs without armrests, generally speaking. Proper movement. If you are in a type of job where there's a lot of lifting, having a proper lifting technique would be appropriate, as well as even wearing a back belt during work would be helpful in preventing back pain as well as in treating back pain. Also, a word of advice is if you have help at work, then you would definitely want to ask for help in lifting heavy objects. If there are tools, for example a forklift or some sort of jack to help to move heavy objects, using those implements that are available at work would be very useful in preventing and treating back pain. Well, so proper movement as well. If you are engaging sports or gym activities, being assessed by a physiotherapist to assess for tight muscles, improper movements, joints that lack flexibility can also help you in preventing and treating back pain. Also your shoes, if your feet are either pronated or supinated. With pronation, what I mean is that your feet tend to turn inward like this, that's pronation, overpronation, and if your feet turn outward, that's supination. So having a poor foot alignment can also lead to back pain. Also, if you have tight muscles, for example, if the glutes or muscle are tight, then that leaves the back muscle with too much extra work to do, and this can also lead to back pain. So again, being assessed by a therapist for muscle flexibility and proper joint movements would also help you in preventing and treating back pain. Now, in terms of symptoms, people describe back pain in many different ways. Some people describe it as a muscle pain or a deep pain, as opposed to a superficial pain where where the skin might feel a burning sensation. That would be more of a superficial pain. When it comes to back pain, that generally is not the way people would describe it. They would say I have a deep pain, or I feel like it's a muscle pain. Also, person may describe a stabbing or shooting sensation. For example, when I say a shooting sensation, a person may feel pain in the back and then they may feel that pain shoot into the buttocks region, the hamstrings, or even the calves. And in the case of shooting pain, that also can be referred to as a radiating pain. Radiating pain, that is, the pain doesn't stay in one place in the back. So you have a back pain and then the pain itself, it basically shoots from the back down into the buttocks, down to the back of the leg. And in the classic sciatica, sciatica is a case where a person would describe a radiating type of pain. So again, coming on to sciatica. With sciatica, the sciatic nerve is involved. And what I mean by involved, the nerve is either impinged or pinched, or there's some inflammation along the path of the nerve. And this is what causes the person to describe down the back of the leg. They got tingling, they got numbness, they got this sort of a pins and needles sensation. Okay, so when the sciatic nerve is involved, those are the sort of symptoms a person may describe. Also, what sort of symptoms they may also describe is that pain that is worse with certain positions or movements. So a person may say with their back pain, if they bend forward, then that is where the pain is worse, or if they bend backward, or if they twist. These are some of the things that a person would describe along with having back pain. Also, some people may say that the pain improves with rest. Okay, so these are just generally some of the descriptions a person would give along their back pain. Now, when to seek medical care. So if you're having back pain that is not improving after a few weeks, this would be a good reason to see a doctor or a therapist. If there are bowel or bladder problems, now back pain with bowel or bladder problems, that is, you cannot control your bowels, cannot control your bladder. This is something that is not to be taken lightly, because what you may have is actually nerve involvement or nerve compression that is leading to bowel or bladder dysfunction. So if you're noticing bowel or bladder dysfunction with your back pain, you really should get that checked out. If also there's a fever with back pain, you also want to have that checked out, because sometimes the pain may not actually be muscular, it may actually be kidney infection. So a kidney infection can lead to back pain accompanied with a fever or even burning in the urine. If also you fell, and then you had the back pain, you also need to get that checked out, at least get an x-ray done along with your medical assessment, because a fall may actually lead to you having a slip disc, which may lead to a pinched nerve, which may then be the cause of your back pain. So trauma associated with back pain is something that is not to be taken lightly, and you really should get that checked out. Just as a side note, once we had an 80-year-old man who came to our office with back pain, and his family described that he fell backwards onto a chair and then began to have back pain. So we had him do an x-ray, and what happened was that the x-ray showed he had a fracture of the back, a fracture of the spine. Okay, now he was 80 years old, and he would likely also have osteoporosis or reduced bone density, and this would make someone very prone to having a fracture of the spine by simply falling back onto a chair. Okay, also again, continuing with when to seek medical care. If the pain is severe and does not get better with rest, if the pain radiates down to both legs, this may actually be a bilateral sciatica. Sciatica generally presents with pain radiating down one side. Now, if you're having pain radiating down both sides, you may actually have a bilateral sciatica. So once again, x-rays or even MRIs may be indicated in this case. If there is a weakness, numbness, and tingling in the legs along with your back pain, again, this is severe. This is serious. You really should not be taking this lightly, because what you may actually have is very severe nerve compression, which is leading to that weakness in the legs. Okay, and you really should see a doctor, get x-rays, get MRIs possibly, and you may actually need to engage in therapy as quickly as possible. Also, on weight loss that cannot be explained. Some cancers do spread to the back, and late stage cancer can lead to weight loss. So if you're having back pain with weight loss that cannot be explained, then you really should get that checked out by a doctor. Now, when I say weight loss that cannot be explained, if you're having weight loss and you know that you are embarking on an exercise regimen or a diet regimen, then that is weight loss that can be explained. But that is different from weight loss that cannot be explained. If you know you're not on a diet, if you know you have not increased your physical activity, and you're having back pain with weight loss, or what you may find is that your clothes are slacker, or you have to pull your belt a bit tighter, this would fall under the category of weight loss. Okay, so back pain with weight loss, with unexplained weight loss, you really should get that checked out. Also, if you have a history of cancer, osteoporosis, which is reduced bone density, steroid use or excess drug and alcohol or nicotine or cigarette use, along with your back pain. If you have these things in your history, if you're using steroid like corticosteroids, if you know you used a lot of drugs heavily, a lot of alcohol, or smoke heavily, and you're having back pain, then you also should get that checked out as well. Don't just sit on that and hope it's going to get better, because it may actually get worse. And what may happen is that you may actually end up needing to get surgery if you wait for too long. And if you deal with the problem earlier, you may actually escape surgery and may actually make good progress with physiotherapy instead. Okay, so what are some causes of back pain? Well, common causes would be muscle strain or spasm. For example, if you fell down or if you try to lift a heavy object, this may lead to muscle strain and spasm. Also trying to lift something heavily without help may also lead to ligament strain, which is also a cause of back pain. Again, falls, accidents, lifting heavy objects unprepared can also lead to herniated or slipped disc. Okay, if a disc is herniated enough or slipped enough, it can lead to what is called a pinched nerve. Okay. Now, in the case here, what we see here in this diagram right here, this is a top view. You're looking at the spine from the top like this, and that's what this view here at the bottom here is. These views right up here, this is looking at the spine from a side view. So if this is your spine here, look at this here, and you're looking at it from this way, then this is what the view that you're seeing. So in the case, this will be a normal spine from the top. This here is this gray area here is the disc, and here is the spinal canal where the spinal cord passes. And this yellow that you see here, those are the nerves that exit the spinal canal. So this is a normal disc. Now, in a herniated disc, when the disc ruptures, you can see you have some material leaving the disc and entering the spinal canal. And this here is a cause for pinching nerves or compression of the spinal cord, or even the nerves that exit. Okay, so this is how a herniated. This is the mechanism of a herniated disc. Now, there's a condition called spinal stenosis. Now, spinal stenosis is really a fancy way for saying narrowing of the spinal canal. And of course, we know there are bones, but there are also ligaments that help to keep the spinal bones together. And if these ligaments get thickened, what they can do, they can actually intrude into the spinal canal, and then you get a narrowing. So here's the spinal canal here, here's your diameter. And when you have ligaments intruding, what you have overall is a reduced diameter of the spinal canal. All right? And by this reduced diameter, you can actually compress on the nerves that pass through the spinal canal. Okay, and that can also lead to back pain. So other causes are arthritis, abnormal spine curves, and osteoporosis. With arthritis, there's a lot of sort of a degenerative picture where there may be loss of disc height, and what you have is some of the spinal bones collapsing downwards, and this collapse downwards can also lead to compression of nerves as well. Or abnormal spinal curves and osteoporosis. Once again, osteoporosis is really reduced bone density, and this can lead to back pain. When it comes to abnormal spine curves, we got scoliosis, then we have kyphosis and lordosis. Now, scoliosis, loosely defined, is basically a sideways curvature of the spine. Okay, and if you look at this picture here of scoliosis, instead of having the bones stacked upon each other like this, what you have is the bones doing something like this. Okay, and due to the curve in the spine, and what you're going to have is one area of the disc is going to be under more pressure than the other area, and that is at risk for degeneration due to the additional pressure due to the scoliosis. Okay, and that can lead to back pain. Now we come to kyphosis and lordosis. What kyphosis really is an exaggerated upper back curvature, a forward curvature of the upper back, and lordosis is excess curvature of the lower back. Okay, so once again, in the same principle, what you're going to have is abnormal loading of the discs as well as the muscles due to the exaggerated curves, and this can also lead to back pain. If you are assessed and you have these conditions, a therapist can help you to restore normal or close to normal curves, and depending on how severe it is, depending on your fitness level, depending on your age. Certain risk factors for back pain, of course, those between age 30 or 40 would generally, that's how you have a high prevalence of back pain, lack of exercise or lack of fitness. If your muscles are not fit and then you decide you're going to lift something heavy or engage in certain activities, you may very well experience back pain because the muscles and bones and ligaments are just not prepared to take that sort of workload. Additional weight, of course, if you are heavy, then you're asking your back muscles, your whole spinal structure to do more work with the additional weight. As a side note, if you're trying to lose weight, it would be useful to also do back exercises to strengthen the back. That will make it easier for it to bear that workload that you are experiencing. Certain medical conditions can lead to back pain. For example, if a person has cancer and the cancer has spread, for example, in prostate cancer. In prostate cancer, when the cancer spreads to the back, a person can experience back pain as well. A poor lifting technique, of course, hunching too much forward in trying to lift a heavy object can lead to back pain. Also, lifting without the appropriate belt or the appropriate assistance can also lead to back pain. Depression and anxiety, there's a psychological component here to back pain. Okay, this can worsen existing back pain. So let's say the average person who does not have depression or anxiety has this level of back pain, and a person with depression or anxiety has the same level of back pain. But the psychological component makes this person experience a worsening. The experience is worse for the person who has depression or anxiety. So pain on the whole also has a psychological component as well. Okay, smoking. A word about smoking. The nicotine in the cigarettes, what nicotine does is causes vasoconstriction. And by vasoconstriction, what I mean is that let's say this is the diameter of a blood vessel and a person is smoking. What that tends to do, it constricts. It causes constriction of the blood vessel. Okay, and what happens is that the constriction leads to a reduced blood supply. A reduced blood supply means that the discs and the structures of the back are less cannot repair themselves as good as if there was an adequate amount of blood supply. Okay, so that is how smoking can worsen back pain, and but it's also by this mechanism that smoking can increase your risk of heart attack, because the coronary arteries also experience that vasoconstriction due to the nicotine. Okay. Okay, now in prevention, we need to look at things like exercise, proper weight, stop smoking, of course, proper posture, an ergonomic workstation, and proper lifting technique. Right, so again, stopping smoking again reduces the amount of nicotine that is in your system, and this would give better blood flow to the back due to the blood vessels having a proper diameter and allowing the proper amount of blood, oxygen, and nutrients to actually nourish the back, which will help it to repair. Okay, so when it comes to exercise again is going to strengthen the structures of the back. If your back muscles are stronger, if you have greater flexibility, if the overall structure of the back is better, then you're less likely to have back pain. Proper weight, again, taking up that excess weight on the back, it is going to definitely help with your back pain. What it will also do, it will help offload. Now, let's talk about something here. When it comes to having a large tummy, what that does, it tends to pull the lower back forward. So you can imagine you having this gut here with additional weight, and what it does, it pulls the lower back forward, and this gives the lower back additional work to do. So by losing that weight, the lower back is now under less strain. Okay, so that is another way in which having a proper weight can help with back pain. Proper posture. A lot of people, when they're at the office or when they're driving or even just looking at TV, they're slouching. This slouching posture, it is a large contributor to back pain, because by slouching, what you're actually doing, you're putting a lot of strain on those back muscles and you're stretching them out. And then what you will find over time, you're having this lower back pain that's very difficult to resolve, because a lot of people, they have a habit in which they're so accustomed to slouching. It's a difficult habit to break, and a lot of the times they come to the clinic and we speak to them and we realize they're slouching a lot. So we say, okay, we're going to treat you for back pain, but at the same time you have to correct that slouching. You have to get rid of that slouching. If you drive for long hours, at least have a lumbar support cushion in the car seat. Okay, that will take some load off the lower back. In the office, make sure you have an ergonomic chair, a chair with proper lower back support that will help you. Okay. Okay, in terms of diagnosing the back pain, in terms of what is the cause of the back pain, There's the patient history, and then there's the clinical examination. The patient history would be basically the doctor speaking to the patient and asking the patient to describe the nature of the back pain, to describe and say, okay, tell me about this back pain, how long have you had it, its severity, tell me what is causing your back pain. So the doctor will then couple the patient history with the clinical examination. So you look at it, you speak to the patient, and then we examine the patient. So we combine these two, and this will basically sort of hone us in terms of telling us what is the cause of the back pain and how it is we are actually going to treat the back pain. In terms of investigations, we're looking at the X-ray, MRI, CT scan, possible blood tests to rule out medical conditions that may be the cause of back pain. Bone scan. The bone scan really is to tell if the person has osteoporosis or a reduced bone density. And then there are nerve conduction tests. The nerve conduction test generally is done by a neurologist. And if there's any pinched nerve, if we suspect there's a pinched nerve, we do a nerve conduction test, which will then tell us to what degree there is nerve involvement. Okay, so these are the general investigations that are done in investigating the cause of a back pain. So here we have an X-ray, which is an investigation that shows scoliosis. So again, remember, scoliosis is really a sideways curvature of the spine, and we can see clearly the spine is curved a lot actually when the X-ray has been done. And here is an MRI. So the MRI here, what the MRI shows us here is that we have some herniated disc as well as some disc degeneration here, as well as, so if you look at something here, you see there's a gray section here in this disc, but when you come here, you really don't see a gray section. It's really darkened out. This generally would mean that there is some leakage of fluid from this disc here. So there has been some rupture and some loss of the jelly-like fluid within this disc. Okay, so the MRI really does give a lot of detail. The MRI actually is the gold standard when it comes to scans looking at when we're trying to look at muscles and nerves. CT scan is really more gives better imaging where the bones are concerned. But if you want to look at muscles and nerves, really the MRI is the gold standard. Okay, now when it comes to treatment, of course, everyone is different. Okay, that's what you got to remember. And there's no way any clinic can give you a 100% guarantee when they're treating you for back pain. You have to basically let the doctor assess you, let the therapist do treatments with you, and then we take it from there. We basically try to see how it is you're progressing with each subsequent session. But there's no way anyone can examine you and then say, okay, we guarantee you 100% you're going to be rid of this back pain. Okay, that doesn't happen. Okay, also in treating back pain, medication-wise, we're looking at anti-inflammatories. You may be familiar with Flamma MX or Cataflam, Voltaren, Diclofenac, all of these names, they come to mind. Muscle relaxants like Midocalm or Norgesic. Also, Flamma MX has a component, is really a combination of anti-inflammatory and muscle relaxant. There's certain gels and creams like Olfen, Divon, Diclofenac creams, narcotics, you can do tramadol, antidepressants, and then you have your steroid injections, where a steroid injection can be done to help relieve very severe pain. But if you're doing injections, then you really should also engage in some sort of therapy. Don't just do the injection alone and not attend to the actual cause of the back problem, the back pain. Okay, also as well, there's therapy and exercise that can be done to help back pain. So you have massage therapy, exercise and stretching, heat therapy, electrical stimulation, therapeutic ultrasound, and also certain muscle release techniques can be employed by your therapist to help you with back pain. Now, in terms of massage, what massage does, one of the key things that massage does is relax tight muscles. A lot of people who have back pain, there may be a component of tight muscles associated with the back pain. So by doing massage therapy, that really can help to release a lot of the tight muscles. And even though a lot of times the massage therapy may just be initiating treatment, you can still get a fair amount, a lot of people can still get a fair amount of relief by just simply doing massage therapy. But it is also advisable that you can also continue after with physiotherapy, exercises and stretching. So when it comes to therapy, so once again, you have physiotherapy, which a therapist will take you through certain exercises, stretches, as well as certain mobility exercises that will help you with your back pain. Electrical stimulation. Now, in terms of electrical stimulation, what electrical stimulation can do, it can help with pain control, but it can also help to relax certain tight muscles. So electrical stimulation can be done in conjunction with a massage therapy. Okay, so which will also help to further release any sort of tight muscles, which can give an additional level of pain relief if your pain is really due to tight muscles. And there are certain release techniques, something called trigger point release. Now, what exactly is a trigger point? Now, let's say you have a tight muscle. Let's say this forearm here was tight. Okay, this muscle was tight, but there may be certain spots along the forearm that are especially tight, and these are called trigger points. So a therapist may actually may put some additional pressure to actually release the tight muscles. So that is called trigger point release. There's also something called myofascial release, which is a sort of massage therapy technique as well. So many techniques are available to your therapist, including things like dry needling and cupping as well. In terms of surgery, now surgery of course is the last resort, but surgery may be employed if the pain is due to structural issues. For example, you have a very severely herniated disc that has been calcified, and therapy is not working. Therapy is not causing any sort of relief of the back pain, and then finally this must actually be released, must be removed through surgical means. Also, if there's spinal stenosis, if the spinal canal has been so narrowed, you are compressing the disc a lot, then in that case surgery may very well be needed in the case of severe spinal stenosis. And of course, once again, if there's any sort of severe disc herniation, you need to use surgery to resect the disc that is actually compressing the nerve, which may be leading to your back pain. Okay, so once again, so just to recap on what spinal stenosis is, if you look at this diagram right here, let's come back to this one. This would be a normal spinal canal here of normal diameter, and your spinal cord will be passing through right here. Now, in the case of spinal stenosis, again, if the ligaments get very large for whatever reason, you know, have a reduced diameter of the spinal canal, this would be called spinal stenosis. And severe spinal stenosis, you may actually need surgery to relieve any sort of pressure on the spinal cord. Okay. And in the case of severe degeneration, if you look at this MRI over here, there's very severe degeneration of the disc here, and this is something that therapy may not actually help. So in cases like this here, spinal surgery may actually be needed to help with the back pain. Okay, so hope you enjoyed that short presentation there on back pain. We are located in Chincuna, Cunupia, Progressive Physiotherapy. You can call or WhatsApp us at 747-5297. If you have any questions, let us know. Thanks.